everyone, and welcome back to the Aruka SDA Health Series on obesity. My name is Nikisha Millett, and today we will be discussing the medical management of obesity. So, just as a brief introduction, I'm going to remind us of the definition of obesity. Obesity is defined as a body mass index of more than or equal to 30 kilograms per meter squared. And we know that the issue with obesity is that it is associated with a range of different medical disorders. Obesity actually can affect almost every organ system, as we would have learned in our previous videos. And so that is why the management of this condition is so important. It can have very detrimental effects on our pulmonary system. It can cause arthritis. It's associated with liver disease, associated with infertility, heart failure, type 2 diabetes, and a host of different cancers, right? And so understanding that, we understand why it is so important for it to be treated. Okay, so with that being said, I'm going to get into the medical management of obesity. Now, I will mainly be discussing drug therapy, which is basically prescription drugs that we use to treat obesity, as well as the surgical management of obesity. And another presenter will speak to you more about diet and exercise. But I do not want us to forget that the mainstay of treatment of obesity is actually dietary changes, exercise, and behavioral changes. Let us not forget that if you take away anything from my presentation, it should be that diet, exercise, and behavioral changes are the mainstay of treatment of obesity. Everything else is used in conjunction with these three things, right? So now that we understand that, let me just get into some of the drugs that can be used for the treatment of obesity. Now, it's important for us to understand, that the aim of treatment is to reduce the burden of obesity on the way in which we live and reduce premature death secondary to obesity, right? And these drugs are actually targeted for persons who are of a body mass index of more than 30 kilograms per meter, more than or equal to 30 kilograms per meter squared, or those who have a body mass index of more than 27 kilograms per meter squared, which would be persons classified in the overweight category, and they also have a serious health condition such as diabetes, high blood pressure, ischemic heart disease, etc. Right? So this is who these treatments are actually aimed for. Right? Drug treatment generally leads to moderate weight loss of about 5 to 10%, but it is effective, and so that is why it can be used again in conjunction with diet, exercise, and behavioral changes to bring about weight loss. Now, drug treatment is usually classified according to the way in which they work. We have drugs that decrease energy intake, i.e. drugs that would decrease the amount of food or the amount of energy taken in from food, and drugs that increase energy usage, so the amount of food, of energy that is used from the food that we take in, right? Now, the first drug I'm going to be talking about is actually a combination drug named phentermine and topiramate. Now, the exact way in which these drugs work is unknown, but phentermine is believed to work due to the release of certain substances that cause a reduction in appetite and the amount of food that a person would eat. And topiramate is believed to work by causing a suppression of the appetite and giving the individual a feeling of fullness. And when used together, they have that effect of giving the person a feeling of fullness and reducing appetite. So they work really well together. Phentermine actually was used on its own, but when used in combination with topiramate, they found that these drugs work well or have a better effect together, right? Unfortunately, as with most medications, these drugs have side effects, and they include an irritability, anxiety, depression, and an increased heart rate. And so this drug is not recommended for persons who would suffer from things like depression and anxiety, for example, because it could actually make these persons' symptoms worse, right? So that is something for us to note with this drug. Now, Lyra Glutide, this is another medication, and it's actually an anti-diabetic medication. It's an injection that works by increasing the amount of insulin released by the pancreas to combat the glucose that is taken in from food, right? So as we remember from our presentations in our last series, or diabetes series, insulin is the hormone produced by the body to break down glucose. And so if there's more insulin being released from the pancreas, more glucose is broken down, so that you have better control of sugar, right? Because we know that diabetes is as a result of excess sugar being in the blood. And so if more sugar is broken down, we have less of the effects of the diabetes, right? This drug is also useful to aid in weight loss because of this, and it also aids to reducing blood pressure. So it has really good effects in that regard. But of course, as we mentioned, with any medication, there are side effects, which include nausea and vomiting, and it's actually associated with acute pancreatitis, which is why it should be used with caution, and thyroid C-cell tumors. So basically a type of tumor in the thyroid gland, right? So of course we have to consider all of these things when/if this medication is used. The next drug that I'm going to be speaking about, again, is another combination drug. It's a combination of Bupropion and Naltrexone. And these drugs are used to combat different addictions. So naltrexone is a drug that is used to aid in alcohol cessation, and bupropion is used in the treatment of depression and also in the treatment of smoking cessation. Now, when combined together, they work to affect the brain to reduce the intake of food. But of course, it has a side effects, which includes headache, constipation, increases in blood pressure, which is why it should not be used in patients who have high blood pressure, and nausea and vomiting. Polystat is another drug that can be used to aid in weight loss, and this drug is derived from a natural inhibitor of pancreatic lipases. Now, what is a lipase? Basically, a lipase is a hormone that is used to break down fat. And so this drug works by blocking those hormones. And when that hormone is blocked, you have less breaking down of fat in the body. It actually works to block about 30% of the fat from food, right? So because of that, the side effects include fatty and oily stool, flatus, which is basically wind from the back passage, with a discharge, increased passage of stool, and fecal incontinence, which is the inability to hold stool, right? But that happens because it blocks fat from being absorbed. The thing about this drug, though, is that because of how it works, by basically just blocking fat from being absorbed, when it is stopped, it can actually lead to weight gain. because it just works by blocking the fat. It doesn't really so it's a temporary measure basically, right? And so discontinuation of the drug can actually lead to weight gain again, because instead of the fat not being absorbed as it was previously while using the drug, it would just be absorbed again, right? And that could lead to weight gain. And so that is why it's important that these medications are combined with diet, exercise, and behavioral changes, because that is the only way that they would be truly effective, right? Now, the weight loss procedures that we have available can be divided into endoscopic procedures and bariatric surgery, right? Endoscopic procedures are not limited to these, but these are the ones that I will discuss, include the gastric balloon, aspiration therapy, and endoscopic sleeve, gastroplasty, and gastric injections. These are all very big words, but when I get to these slides, I'll explain and break it down, simplify it so that we can all understand, okay? So the gastric balloon is a balloon that is inserted into the stomach that reduces the volume of the stomach so that the patient would feel full faster, they would consume less food, and that would lead to a reduction in weight, right? How this works. So basically, how the procedure is performed: an endoscope, which is a device that passes through the mouth, goes into the esophagus, which is the tube that connects the mouth to the stomach, and then passes into the stomach. That's passed in initially to survey the stomach to make sure there are no signs of inflammation, no ulcers, etc. in the stomach. Once the stomach is determined to be healthy, the uninflated balloon is passed with the endoscope into the stomach. Then saline solution is used to inflate that balloon, and the endoscope is removed. The balloons then, because it's a dual action, it's a dual balloon, they would stay in the stomach for about 6 months, and they reduce the stomach volume because they take up space there, right? That reduction in stomach volume would lead to that patient feeling fuller faster, so they consume less at a meal sitting. And after about 6 months, the balloon is deflated and then removed. So the goal again with that, of course, this has to be used in conjunction with behavior changes, etc., is that the patient continues to have smaller meals, and that they would factor in the exercise as well, so that when the balloon is removed, the weight loss, sorry, is continued. So it's not just limited to the time when the balloon is in there, but when you change your behaviors, when like the patient has less meals, etc., they would do better to continue to lose weight, right? The next procedure that I'm going to be speaking about is aspiration therapy. This procedure involves the insertion of a port that connects to the skin and allows the patient to drain about 30% of the calories that they would eat, right? So this port stays in the stomach for about a year, and during this time, the patient is supposed to be cultivating better habits like drinking more water, chewing their food more vigorously, snacking less, etc., so that they can maintain those habits once the device is removed. Because again, these devices are just used in the short term, but ultimately they're used for the individual to have time to cultivate better habits, to eat less, etc., so that once they are removed, they can continue to lose weight. They don't just regain the weight after the device is removed, right? Now, endoscopic sleeve gastroplasty. Very long phrase there. What does that mean? Now, remember, we said an endoscope is a device that is passed through the mouth into the esophagus, then down into the stomach to access the gut, right? So, endoscopic sleeve gastroplasty basically means a procedure in which an endoscope is inserted and the size of the stomach is reduced by placing stitches in the stomach. And so basically it's the changing of the stomach volume so that the patient would consume less food because they feel full faster, right? And thus that would lead to weight loss. Now, the stitches last for about a year, after which they completely absorb, and this is associated with actually a significant amount of weight loss, about 20%. But of course, again, this has to be maintained by the continuation of having smaller meals even after this procedure, after these stitches would have dissolved, right? Gastric injections basically are just as the stomach as this picture says. It's stomach Botox. We all know Botox when you see those people on TV and you see they have their face like frozen in one spot. Basically, it's the same thing that's done to the stomach muscles. So, botulinum toxin, which is what we know as Botox, is inserted into the stomach muscle and actually freezes the cells so that digestion slows down. With the slowing down of digestion, the patient actually starts to feel full faster. And this is a great procedure because it is minimally invasive. Of course, it doesn't last forever, just like regular Botox that we know with the face, right? Um, but it is a good temporary measure to allow the patient to have less meals because if you feel full faster, you tend to consume less, right? So it's a good temporary measure to promote, again, the habits of having smaller meals to facilitate weight loss. Now, bariatric surgery, I'm going to be talking about four main types, but there are other types that are in development, etc., that I won't be discussing here today. Going to be talking about gastric bypass surgery, which I'm sure all of us would have heard about at some point in time. We may not know exactly what it means, but we heard the term before: gastric banding, a sleeve gastrectomy, and this very long word, Bilio pancreatic diversion with a duodenal switch, right? So, gastric bypass surgery, the reason why we all heard of it before is because it's the most common form of weight loss surgery and it leads to a significant amount of weight loss. About 50 to 65% of weight is lost after 2 years, right? This procedure is actually available in Trinidad and Tobago. Now, for persons to qualify for gastric bypass surgery, they need and for any surgical intervention rather, they need to have a body mass index of more than or equal to 40 kilograms per meter squared or a body mass index of more than 35 kilograms per meter squared and a significant medical condition such as diabetes, high blood pressure, ischemic heart disease, etc. Right? They have to have an acceptable operable risk, meaning that they can't have any condition that could cause them to die on the table. That's really important because obviously if you're going to operate on somebody and they're at risk of dying, that doesn't really make sense. Right? So they need to be well enough to undergo surgery. They also have to be well informed and motivated. And the reason why motivated is inserted here is because surgery alone is not how they should be treated. After surgery, this individual also has to commit to a healthy diet, to exercise as well, to facilitate continued weight loss. Because it doesn't make sense performing surgery and expecting all the weight to drop. You actually have to be consistent with the conservative management, such as the diet, exercise, and behavioral changes in order to maintain weight loss. right? And they also have to have tried non-surgical methods such as diet, exercise, behavior changes, and medications, and not achieve satisfactory weight loss. That is when they would be considered an appropriate candidate for surgery, right? Now, the good thing about gastric bypass surgery is actually that it can lead to the remission of certain chronic illnesses. So persons who, for example, have diabetes after they undergo gastric bypass, about 62% of them actually no longer have the condition after the procedure. And so it is a very effective so this procedure, sorry, is very effective for the remission of certain chronic illnesses in persons who are obese. Now, adjustable gastric banding. This involves the placement of a band on the upper part of the stomach, as we see in the picture here, giving the stomach a smaller pouch and then a larger lower pouch, right? That leads to the stomach having a smaller volume, and so it holds less food, the patient feels full faster, and thus it leads to weight loss. As a matter of fact, about 45 to 72% of the weight is lost after 3 to 6 years of this after 3 to 6 years when this procedure is performed. And so this can actually be done laparoscopically, which means it can be done through little keyholes in the stomach as opposed to a big open procedure. So it's a very effective um, way in which individuals can lose weight as well. Now, a sleeve gastrectomy, as it says, gastrectomy is removal of part of the stomach, right? So it involves the removal of part of the stomach with the creation of this gastric sleeve. So again, this works by reducing the stomach volume. If you have less of the stomach to full, the patient would feel full faster because less food is required to fill the stomach. And the weight loss in this procedure tends to be higher than those who have undergone gastric banding. So about 33 to 58% of weight is lost 2 years after this procedure. Now, it's a good procedure because it results in significant weight loss and it requires a relatively short hospital stay. But unfortunately, it can result in nutritional deficiencies, and so persons that have undergone this procedure should be ideally supplemented with natural supplements, etc., to ensure that their nutritional needs are met, right? Now, this very long word that we meant, this very long procedure that I mentioned before, bilio pancreatic diversion with duodenal switch, is the least common of all the procedures that I mentioned. This is a three-part procedure which it involves the removal of part of the stomach and then a switch in the first part of the intestine, which is the duodenum, right, to another part of the smaller intestine, thus bypassing a significant amount of the small intestine, right? You also have in this procedure less absorption of bile and pancreatic enzymes so that less food is broken down, right? So it works in a threefold way. Because the stomach, part of the stomach is resected, you have the stomach volume is smaller, right? And so the person would naturally feel full faster that way. Then because of the switch of the first part of the intestine, you get a significant amount of the small intestine, which is useful useful for absorption of nutrients is bypassed, and so you have less absorption of the nutrients from food. And then because the pancreas and the gallbladder and stuff are bypassed, and no bile and pancreatic enzymes that are used to break down food are present, that also again leads to less nutrients and stuff being absorbed. Because of this though, this procedure is very advantageous because it leads to a significant amount of weight loss. So persons lose about 60% of the weight in their 5-year follow-up, and you have more than 70% of less fat, being absorbed. And of course, because we resecting part of the stomach, you reduce the appetite and improve the person's feeling of fullness. But the procedure is a very complex one, and so it results in longer hospital stays, and nutritional deficiencies can develop from this procedure. So again, these persons need to ensure that they're on some sort of nutritional supplements to make sure that their nutritional needs are being met. And it requires, and that is why it requires strict compliance with dietary advice, we mentioned this again, and vitamin supplementation. Okay, so just a little summary, right? The rates of obesity are steadily increasing, and so the burden of this disease is also on the rise, right? Diet, exercise, and behavior changes are the mainstay of the treatment of obesity. Let us not forget that. That is the most important point I will say here today. And medical and surgical treatment are just reserved for those persons who have tried diet and exercise and they have not achieved satisfactory weight loss. So again, diet and exercise are the mainstay of treatment, but if that fails, of course we have options with drug therapy and surgery to aid in weight loss. Now, just some words of encouragement for persons who may be battling with obesity and trying to lose weight. I just want to read this text from 1 Corinthians 9:24-27, and it says, "Do you not know that in a race all the runners run, but only one receives the prize? So run that you may obtain it. Every athlete exercises self-control in all things they do. Every athlete exercises self-control in all things. They do it to receive a perishable wreath, but we an imperishable. So I do not run aimlessly. I do not box as one beating the air, but I discipline my body and keep it under control, lest after preaching to others, I myself should be disqualified." And so I just want to admonish all of us. I'm speaking to myself first, all those who are trying to cultivate better habits. The purpose of this health series is not just for us to give information, but also for us to introspect and to work on doing better in terms of our health. That we have to remain consistent. A trained athlete exercises self-control in all things, meaning that in the way in which we eat, the way in which we condition our body, or eat or sleeping habits, etc. All these things require discipline, right, in order to do the right thing. And so for all of those of us struggling, it's just for us to remember that we have to remain disciplined, we have to remain consistent in order to achieve our goals. And so I just hope that all of us can find encouragement in this, and we can, remain committed to what God desires for us. Right? So I want to thank everyone for tuning in. I hope that this was informative. I hope that you all would have learned something. And on next presentation will deal more on diet and exercise. I know that would be a very interesting one, and so I hope that we all tune into that. And here are my references. So if you would like more information, you can always access any one of these articles, and you would be able to, get some more information. Bye, guys.